Thanks very much for having me here today. What I wanted to do, or what I've been asked to do here, is to try and take some of the research and some of the evidence that we've been hearing about so far today and to think about how that might get translated into getting some direct measures on what's happening in New South Wales and amongst workplaces in New South Wales, and then how that can be used to try and drive change. So unusually, for a mental health conference, I'm going to start talking about strokes. And there is a reason for this. So I think most people know what a stroke is. But actually, the management of strokes has some similarities with trying to manage mental health in the workplace, in that there's not really a single thing that you need to be doing. If somebody comes into hospital with a stroke, there's a whole variety of things that you need to be doing to try and keep them well and to maximise their recovery. There's some things, some very practical things you need to do in terms of getting them into a scanner to work out what sort of stroke they're having, getting them onto a stroke unit, getting the treatment, but also other things like speech and language therapy. So it's a complex mix that you need to be doing. And an idea that they had in the UK, and actually it goes back further than what this graph suggests, goes back to the 1990s, was to start auditing what's happening in different hospitals around the UK in terms of their stroke management. And they developed a simple benchmarking tool where they went into hospitals and they said, well, let's have a look at the last 20 patients that came in who've had a stroke. How did they do? When did they get their scanning? Did they get admitted onto a stroke unit? Did they get a speech and language therapist assessing their swallowing within the first 24 hours, etc., etc.? And you got marked somewhere between an A and an E in a rather pejorative way, which might remind people of their school reports. But anyway, you can see back when they used to do it, the majority of hospitals weren't doing that well. We're getting Ds and Es. But what this prompted was a range of interventions, both at the national level in terms of how strokes are managed, and also within individual hospitals where they were looking at what they're not doing well, what they could improve. And you can see that over the years that this was repeated regularly, you got a gradual improvement with more and more A's creeping in. And why that's important is if you look over the same time period and look at the mortality from strokes in the UK, there is quite a significant decrease in mortality. And the treatment for strokes really didn't advance over that time. So this was all about finding a way in which you could measure what is going on in ordinary day-to-day practice, being able to influence that and being able to have a dramatic impact on outcomes. And if I had come up with a medication that had that sort of response to strokes, then you'd be a rich person. So I put this up here in terms of, I think it's one of the classic examples in clinical medicine about why it's important to measure what's happening and to think about how you can utilise that to try and make change. So if you were going, so in terms of making that type of benchmarking tool, obviously you've got to decide what you're benchmarking against. You know, what is it that you want, in this case, organisations and workplaces to be doing? How can you measure that in some sort of reliable way? And then what do you do with the results? How do you use them to implement change? Now, my parents always used to tell me you shouldn't take credit for what you didn't do. And indeed, I learnt this the hard way when a girlfriend of mine got delivered flowers anonymously and are attributed to me incorrectly. But obviously, in academia, a lot of people make a career out of taking credit for what other people did. And I thought for once I would try not doing that. And so I just wanted to point out that the data that I'm going to present here isn't actually one of my own research projects. This was something that was very much run from SafeWork New South Wales, and they utilised an external company called Instinct and Reason to do a lot of the work, and I'll kind of step through what happened there. But I think it's important to know who did it, because this is not something, you know, SafeWork New South Wales drove this but gave it out to other people to do. And that also there was a group of academics, and many of them you've heard here today already, who informed that process in terms of trying to take this evidence and translate it into what should work. So it was really a group initiative and a group outcome. Okay, so the point of me speaking after Nick was that hopefully at the end of Nick's talk we've got this idea that actually there are a lot of unanswered questions around what we should be doing in the workplace, but we are beginning to get a sense of what sort of things should be happening. And Nick pointed out there is a framework that a number of us have come together and talked about that puts some constraints around that. There's obviously his report that we've got here. We've got the work from Beyond Blue and the Mentally Healthy Workplace Alliance that's on the Heads Up website with similar reviews. So I think it's important for us to say that there are things we don't know, but there are also some things that we do know that workplaces should be doing. And what came out of some of the meetings that SafeWork New South Wales convened, when you had a group of people like Nick and myself and Maureen and other people sitting around the room, is sort of saying, well, okay, well, what would a workplace that was doing an integrated and sustained job of workplace mental health, what would that look like? What sort of things would they be doing? And then moving down a step and saying, well, okay, but what about a workplace that was sort of doing good active things but not quite that sustained process? What would that look like? And a series of questions emerged of things that workplaces could be doing. And at the time, they were conceptualised by the group as really being around 6 themes that were based on some of those frameworks which Nick talked about. And obviously there was stuff around leadership and culture. Excuse me. There's stuff around work design and risk management, which was some of the talks we heard about before lunch. There's stuff around to what extent you are consulting and engaging with your workforce, the education and training you can be doing, the type of manager training that Nick was referring to, and support services in terms of are there good quality evidence-based support services when people start to become unwell. So we had 42 questions that addressed some of these. To give you a feel for it, within the education and training one, these are a couple of the sorts of questions we asked. Are the managers in this workplace, do they get training on how to prevent and manage stigma around mental health? Are they getting training in how to design safe workplaces? Now, of course, they may be getting designing around safe workplaces in general, but then they were asked, to what extent is there an overt and specific consideration for mental health in some of these? Anywhere from really they're not doing anything with consideration to mental health through to considering mental health across the business in a tailored and continually reviewed way. And what we wanted to do, or what SafeWork wants to do, and what we assisted them to do, was we wanted to try and get a snapshot of where businesses in New South Wales were at the moment with this spectrum of things that we would ideally like them to be doing. And so to do that, we decided that if we got around 2,000 workplaces, now we specified workplaces as being places where there were 5 or more employees there. So this obviously excludes a huge number of businesses that are out there that are those micro businesses with a single individual or just a couple of individuals. The sampling was undertaken in a way to try and get an appropriate mix of company size, industry and location. I'll put some figures up that speak to that in a second. Now, when of course the decision is, okay, we've got these 42 things that are a list of things that we want to know whether you're doing or not. How do you decide whether an organisation is doing it or not? We heard in Maureen's talk that you can get very different answers to a question on whether you ask the leaders or whether you ask the workers. Those theoretical concerns had to be weighed against the practicality of wanting to get this done in a reasonably time-efficient way. So the decision here was to ask the decision maker who is responsible for mental health and wellbeing in the organisation and to ask them these questions. Now, the more astute amongst you will of course say, hang on, can they be trusted to answer this? Like essentially you're asking them if they're doing their job properly, which is kind of true. And so what we did as part of that was that during the pilot stage, a number of organisations, we asked multiple people within the organisation to see whether you're getting the same sort of answers. And we also asked a group of employees to see whether what the person in charge of health and safety, whether what they were saying seemed to match correctly with what the employees were seeing. And look, it wasn't perfect, but there were some questions that did better than others, and those ones that were causing problems on this were excluded from this, or the wording was changed to try and get more of that inter-rater reliability. And it was a lot of work. Instinct and Reason had to make around 8,000 phone calls to get 2,000 workplaces to do that. A lot of that was having to repeat phone calls to get the person at the right time when they could answer it. And of course, some workplaces just refused to do it. So this is who made up the 2,000 workplaces. So you can see there is a mixture of industry groups, and that they are and a mixture of industry sizes, and there was a matrix to try and get that so that there were enough in each cell to be able to look at some of these things. There was an effort to make sure that it wasn't all just Sydney-based organisations, that they got some from some of the bigger centres like Newcastle and Wollongong, and also from some of the regional centres. Now, this is a busy slide, and it's a busy slide for two reasons. Firstly, because I couldn't think of a way of making it less busy. But secondly, is because I'm about to talk about some statistics, and I'm aware possibly the entire room will not want to listen to that. So if you don't want to listen to statistics, this is your chance to read the content of that slide to stop you wandering off too much. When you get those 2,000 organisations answering those questions about 42 different things, you can do something called a principal component analysis, where what you do is you have a look at how each of those 2,000 organisations answer those 42 questions, and you can look for things that seem to cluster together. And this is the way that that when we're trying to work out what's the best way to ask about depression as opposed to anxiety, this is the way you this is the way you validate those scales. And so Instinct and Reason did that principal component analysis where they looked at the way of all these 42 questions and said, actually, you know how you thought there were 6 things that you were asking about? Actually, when we look at the data, they really seem to be clumping together into 4 groups. And so a group of us looked at those clusters and said, yeah, they actually, they theoretically make sense, the way the people their answers are clustering. That, yes, there are a number of questions that are asked around policy and processes, and you can see examples there around, do they have a strategy, do they have a plan? There is a series of questions that ask around managing risk in the workplace, and this really probably combined 2 of those ones that were in the original 6 that we talked about, in terms of, are the risks measured, do people act on it when they get that measurement, how is workplace health and safety promoted, those sort of things. Then there's support services, so that's pretty simple. What are the services that are put in there to respond when people feel they need help? Is there a peer support program, EAP, etc., etc.? And then education and training. So it was a subtle shift, but at least it is a data-informed cluster here rather than the collective thoughts of the people who are at that meeting. Okay, so then you ask all these questions, and how the hell do you pull this into something by way of getting that snapshot of where New South Wales is at the moment? How do we get the equivalent of those graphs that we saw for the stroke audit in terms of, if we look across workplaces in New South Wales, where are they on that stretch of A, B, C, D or E? We obviously didn't want to use that terms because it really, I think it risks creating a wrong impression of what this benchmarking tool was about. This is not about going in and trying to individually name and shame organisations. This is about trying to get a snapshot of where New South Wales is at, where different industries or regions are at, and thinking about how we take the next steps. But we wanted to try and stratify organisations as to where they sat on that continuum, from basic awareness through to having intention to do things, undertaking some limited action, undertaking more effective action, and a process that was integrated and sustained. And the scoring mechanism that was come up to do that, it's a combination of both how well individual companies scored on the questions that they were asked, and also how balanced it was across the whole area. It's no good having a company, well, it's not that it's no good, it is no good not recognising when you have a company that's doing great things across 3 of the 4 domains, but then in one of the domains is not really doing anything. That has to be captured in somehow how you do it. So I suspect we could, and indeed we did, there was an awful lot of back and forwards about where these thresholds should be, how you should do it, and of course there is a subjective nature with that. But it was a group that did it, and so it was a consensus, and it was felt to be the right balance of the various possibilities. Okay, so enough talking. This is the slide that I suppose provides the snapshot of New South Wales businesses according to this benchmarking tool. And you can see that we have that sort of continuum of 5 things, from basic awareness through to integrated and sustained approach. And in terms of the weighted percentages for organisations in New South Wales, we had about 9% of organisations that were at that integrated and sustained approach across all the different domains. The vast majority of organisations were sitting somewhere there in the middle, with about 14% at effective action, about 30% in limited action, again another 30% in that lower level of intention, and then just under 20% at the basic awareness. I mean, I'm interested to know, do people feel that sort of feels about right? Because that was sort of one of the things that the group looking at this sort of came to, was that, well, we've made all these little decisions along the way, and this is the answer. Does that feel intuitively right to people? And perhaps when we have the question and answer session, we can sort of have some discussions around that. One of the things you might have noticed on that slide, but which is hopefully a bit more obvious on this one, is there was a differential in terms of whether you looked at small, medium or large organisations. And you were more likely to be in that integrated and sustained group if you're a large organisation, and conversely more likely to be in the basic awareness if you're a small one. Interestingly, in the middle, it was really a sort of an effect at the top and tail of that category. If you look in the middle around effective action and limited action, actually they were pretty even, or even in some cases, some of the small and medium organisations were doing better than the large. To me, this raises a really interesting question. I have no doubt that a benchmarking tool like this is biased towards favouring large organisations, because they have the resources to do a number of those 42 things that you are listing there. So I'm sure that's part of the difference you see here, but I think there is also the real possibility that this is capturing an issue that it is it is jolly hard to do some of these things if you're a small business owner. And we did sort of modify some of the thresholds that we use for small businesses for some of the individual questions in terms of, did they have a written policy? Well, if it was an organisation with 5 people, and if there was a clear commitment, but that wasn't a written policy that was ratified by the board, then there was some of that flexibility there. But either way, I think this is something that requires more attention and more discussion to think about how we respond to that. I think the easier way, because also what I said from the start that this type of benchmarking tool should be good at doing, is about thinking about, well, how do different industries compare? How do different regions compare? What are companies in New South Wales doing well? What could they do better at? And I think the easiest way to visually answer some of those things is to look at the average score for the questions, rather than that sort of more complex algorithm of average score plus the spread across the different domains. So as an example of that, this is looking at exactly the same thing of small, medium, large companies, but instead of looking at how many were in those 5 strata, what we're doing is just looking at the average score for all 42 items, and you can see the same picture emerging. So if you look at industry groups and you look at what the average score across the 42 items were for the different industry groups, you can see that some industry groups, retail, mining, electricity, they seem to be doing quite well and certainly doing better than average in the scores, whereas some of the other ones down the bottom here in terms of transport, public administration and safety, media, communication, they're doing less well. Having said that, actually, there's not too much of a spread, and you could argue that one of the overall conclusions is that most industries are doing pretty well, and that average score out of 5 is pretty good, but there is nonetheless a spread, and we can probably learn some things from that spread. Similarly, you can look at the regions, and interestingly here, and I don't know which way people would predict it, but Sydney was doing less well than average, and it was some of the regional areas and some of the regional, like Newcastle, was doing well. I guess people from Every Mind would say that that's because Every Mind is based in Newcastle. People from the Black Dog wouldn't say that. Um, now, bad enough to show the busy slide once. Now I'm going to show it twice. And this is just to remind you that we had those 4 areas. And one of the things that I was really interested to see was, out of these 4 areas, which were the areas that organisations in New South Wales were doing well at, and which were they doing less well at. And there was more of a spread here. And you can see, and I'm sorry, the font's not brilliant there, but that top one is managing workplace risk. So that was all around, are you measuring risk? Are you doing something with that information? Second one's policy and procedures. Third one's education and training, and this is support services. And you can see a pretty clear pattern that businesses in New South Wales are doing more around managing workplace risk and policy and processes than they are around education, training and support services. Now, my take on this, and I think I should put a caveat here, this is sort of, this is my opinion and not the consensus opinion of the group that did this, is that I think there might be something in this that actually the occupational health and safety leaders, who are often the ones driving this thing within organisations, that it is probably more in their culture to be thinking around risk management strategies and how you use policy and procedures to do that, because that really has been the cornerstone of workplace health and safety in terms of all of the risk management strategies that go on. But as Nick pointed out, it is yet to be entirely clear how effective those strategies are in workplaces, or how we best utilise those strategies in workplaces. Conversely, thinking about education and training managers around mental health, getting the support services right, arguably, and as Nick pointed out in his review, there's arguably a stronger evidence base for those types of interventions, but perhaps less of a culture of getting them right within workplaces. And so maybe this is the type of thing that we're going to be able to get from this type of benchmarking tool, about noticing these patterns and implementing things to try and change that. So some of the questions that they scored particularly well on, and then this matches those clusters that we were talking about: organisation safety culture is everyone's responsibility, managers cooperate with workers, to, God, I can't even read that, what chance have you got? Risk to inform workplace health and safety, types of workplace safety, incidents are recorded, those types of policy risk management things, whereas some of the other ones that they're scoring less well on are workers have access to peer support services, the organisation monitors the use of support services, organisations evaluate the support services they use, is it evidence-based CBT mindfulness type stuff or some other nonsense. So interestingly, a little question that was added in this survey, and I like this type of thing. You think, God, you're going to have 2,000 companies on the phone. We're asking them a load of questions. Let's get some information from them. And so at the end of the interview, they said, hey, look, what's the one thing that you think could be done to better support mental health in the workplace? And these were the sort of top 10 answers that came up. The number one was communication with staff about mental health. I think that's, and it was number first by quite a way, and I think that's really interesting, and that's been something that's been touched upon in a couple of talks this morning. Indeed, it was a lot of the driver behind the manager training that Nick was talking about, trying to promote that. Mental health awareness, support services, which we know are perhaps not being done as well as some other areas. Trained managers in mental health, that was really there. I didn't put that there. Reducing stigma was a big one. You can read the others. But it was interesting that actually these answers were mapping reasonably well onto the type of framework that we've been talking about, which was pleasing, really. So what do we do with this type of benchmarking tool? How do we take this as our ground zero of where we are at the start of the process? Firstly, what can we and SafeWork New South Wales and other people involved in this space, what can we be doing to try and help organisations move up through this hierarchy? How can we get more that are down in these levels moving up? How can we support that? Do we want to measure that as it happens? Do we want to be able to come back here in a couple of years' time and produce a graph like I showed for the stroke, where this is where we are at the moment with our 9% up in the green area, and be able to show that this is the sort of track that we've been able to do over time? And then are there other possibilities for this type of benchmarking tool? those types of stroke tools, what you can do now is if you run a stroke unit in a hospital, you can go online and answer the questions yourself just informally and see where you sit in the spread, get an idea of where you are benchmarking against other similar organisations. Do we want companies to be able to do that? Do we want companies to be able to get individual results to help guide what they should be doing better? If we're going to start thinking about that, then I think what we need to do is also be honest about some of the limitations of this type of tool we have at the moment. How can we work to get this validated against more objective outcomes? How can we show that actually if you get organisations scoring better, that is making a real difference to workers? How do we further test whether getting a single person to report on this is a valid way of doing it? And how do we include new items over time? You know, as studies come out that show that particular types of apps are helpful, for example, how are we going to include that in the benchmarking tool that means it's still going to be useful going forward as a measure? And I think this issue around small and medium-sized organisations, do we need to make other modifications for that? And how do we work with that? So there you go. I think I was going back to that slide just as a sort of headline finding. The full report is in the folders that you got. And I promised that I was going to be faster than Nick, just for bragging rights, and because it seemed like the right thing to do, given that afternoon tea's on the end of it. So thank you very much.